Hello beautiful people, my name is Oyedoku Precious Ayomide. I am an occupational therapist and a family consultant at Ease Neurocare. So today I'll be talking about an approach that is used in managing individuals with autism and special educational needs. The name of this approach is called SPELL approach. SPELL approach, the SPELL approach. SPELL approach is actually an acronym. The word SPELL is an acronym used for an approach in managing individuals living with disabilities, where the S stands for structure, the P stands for positive, the E stands for empathy, the L stands for low arousal, and the last L stands for linking. I'll be talking about this in details. Now let's go to the first letter, which is S. Remember I said the S stands for structure. Structure, which is the first component in the SPELL approach. Yeah, this talks about the importance of creating or modifying an environment in a structured or easily predictable way. Okay, let me explain this. Applying the word structure in managing individuals with special needs. This means that the environment, wherever environment, any environment whereby this individual with a special need stays or lives needs to be structured and easily predictable, whereby they know what to do, how to do it, and what to do next. Okay, let me give an instance of using the toilet. An individual living with special need, I'm talking about in general now, individuals living with special need, okay, for instance, let me give a name. His name is Ade. Now you want to apply this structure approach, which is SPELL approach, as an environment. You know, using the toilet is an environment on its own, and it's actually structured, whereby you need to go to the toilet. Then when you're done, you pull down your undies and do whatever you want to do there. The next thing, you clean up and wash your hands. You can see it is structured. The child knows that when I want to go to the toilet, I need to. Some of them will just go to the toilet and just mess themselves up, even while trying to use the toilet, you know. But trying to apply this approach, you need to break down this analysis. You need to break down these tasks into baby steps, whereby using visual prompts, pictures, timetable to help them understand what to do whenever they find themselves in various environments. Okay? Yes. Okay. Let me give another instance. A child that wants to take his breakfast. The child giving tantrums, be it verbal or non-verbal. The child should understand that in the environment whereby he needs to take his food, he needs to go to the kitchen or call somebody, notify the person that he is hungry, and goes in there. You know, he has to get his plate. They go towards where he can get served. I know of children that they just bump into the kitchen and open the pots, just, you know, pick food into their mouth. It's a no. We are not helping these children, because if they go out there, they would, you know, do same thing. But whereby parents try to apply this structure as an intervention to help them, you know, the child is hungry, he wants to eat. It asks maybe another person, okay, I want to eat. Go get your plate should be the first thing. At least you can't eat in your palm, so you go get a plate. The child understands, okay, I need to get a plate, I need to get a spoon. Then once it's served, I need to go to the dining table to sit and eat my food. You can see you've created structure. Getting your plate first, your spoon, the tray, the cup, and the likes, going to the dining table to eat, or the dining room to eat. Unlike just sitting on the floor and eating, it doesn't actually speak well. So creating a structured and predictable environment. This would help every individual living with special need, behavioral conditions, be it physical condition and the likes. Permit me to say this. The way environment can be structured, do you know that communication also can be structured that way? Yes. We want to actually engage a child in communication. We want to give the child an instruction, and you just give the instructions. You just say, go and trash this. You did not call the child's name. You just gave the instruction. How would you gain this child's attention? You can't. So for you to also have a structured communication, firstly, what you have to do is call the child's name. Okay, Joy, come here. Go and trash this. And note, give the child time to process the instruction. Give the child time to process that instruction given. You can't just say, Joy, go and trash this, and instantly the child will understand you. Even some normal children take time to, process the words you say to them. Not to now talk of children that has a need. So you let them, give them adequate time to process and respond to that instruction. With that, you've given them a structured way to communicate. Let's go to the second approach, which is the letter P. Letter P stands for positive. Yes. Did you know as a parent that for you to explore the potentials of your child, for you to explore the potentials of individuals living with special needs, you really need to focus more on their positive behaviors and their strengths, rather than for you looking out for their negative behaviors and weaknesses. Because many parents actually do this a lot. They focus more on the negative aspect and just ignore the positive aspect of this child. And doing this, you are causing more harm than good in life of this child. Every child has their uniqueness. Why don't you focus on those strengths and bring out something good in them, rather than you focusing on those tantrums, negative behaviors, weaknesses, and you keep on complaining, getting frustrated at all they do in that very part. As parents, when we keep up with focusing on the positive aspects of our child, we see them do better in this society at large. And how can we focus on this positive aspect in our children? How can we apply this positive approach in managing children living with autism and other special need conditions? Yeah, the first one there is positive reinforcement, praises, appraisal, and lots more. This would actually help this child, grow, feel more comfortable, more independent, and be willing to learn and grow more. Rather than for you just criticizing the child, you don't know how to do this, you don't know when will the child know how to do it better? All you are fond of doing is, I'll spank you, you're naughty, you don't do that. You just keep up focusing on those negative aspects. You won't see the good parts, the good quality this child has. But when you apply this approach by focusing on those positive aspects, for instance, I want to let you know that little things count. Every little thing our children do, it really do count. It's not necessary we get them something big to say, yes, you are doing a good job. You can actually use your words. Good job, job well done. Ogie, high five. This will keep them motivated. It will make them feel comfortable that, oh yes, I did this today, mommy gave me an high five. This is very good. I think I can do this better. For instance, the child came to meet you. Okay, let me give an instance of the child I'm working with. She doesn't have much words, but whenever she comes and says we, because that's the new word she used, and high five, now you can go use the toilet. With that, I'm motivating her, and with that, now she expressed herself, we. I will know, okay, she wants to go and be. But what is we? Go and sit down, Joe. Or for a child that doesn't maybe does not know how to say take. And for the first time this child said take. You should not say You should try to motivate that child, encourage them. With that, even communication will come up. The things those children don't do with one day, even if it is little, they actually make effort in doing. You praise them. It will make them, feel motivated that, oh yes, they gave me an high five today. Mommy hugged me today. Oh, mommy got me a teddy bear today. In their mind, they want to do more. And these are the ways we can actually use in applying the positive approach. Because doing this will make these children, feel motivated, happy, and comfortable to be around you. And when everybody also understands this, it will make these children live a fulfilled life. Not everything, you scold them, go sit down there, just shut them off, try not helping them to come out of their shell. They will not start living in the life of being scared. If I do this, they will talk. What if this is wrong? What if this is right? And when they start getting scared and you keep on killing their potentials. But when you give them that room to bring out their strength, then for instance, a child that doesn't even know how to let's say hold his pencil, as a teacher, you're also a carer for a child that has poor pencil grip, and the child eventually scribbles just once in a blue moon. Wow, good job, well done. Can everybody please clap for Ada? Saying that will motivate Ada to be able to do this better. Oh, they clapped for me. With that, she keeps on doing it. Even if she's not doing it, you keep on praising her. With that, her strength will start coming out. So as parents, let's try to apply this approach in managing our words. All right. Now to the third acronym in SPELL approach, which is letter E. The E stands for empathy. And empathy is actually seeing the world through the eyes of individuals living with autism and special needs in general, and not sympathizing for them. In Nigeria, many of us show sympathy and not empathy, whereby we are actually, showing this kind. I'm not saying you are not concerned, but you are giving them this pity look. Hey, so sorry. You actually say that the child is not working yet. Instead of to show empathy, okay, this is the reason why this boy is this way. Hey, he can't work. How are we now coping? You don't show pity. You show empathy. You don't sympathize. You show empathy. Showing empathy is the most important aspect of working with individuals living with special needs. And to get a better insight into their world, it is very, very important and essential to understand the experience by viewing things from their perspective. I saw an animation one day, and I really wished many people that could actually see this and understand, why some children give tantrums, why they have meltdown, and lots more. It's actually story about children in the class. They noticed that, okay, a child living with autism suddenly just starts screaming and the likes. A boy now started enlightening them, telling him, okay, the reason why he's screaming is because of this. The way his brain is being wired is different from the way ours is being wired. So whenever they see him, they don't see him as a troublemaker. They don't see him as a child that is strong-willed. But they come into the aspect of, okay, his brain is wired this way. That is why he is acting this way. Are we getting it? Showing empathy is very, very important because it will help us to understand them better. Some individuals that are non-verbal, they have a lot of things to say through gestures, through behaviors, through their gestures. But many of us don't pay attention to this. We don't pay attention to details, especially with children that are non-verbal. So let's learn to show empathy and not sympathize with these children. This approach will help us well to make these children function well in the society at large. Now to the fourth acronym in the SPELL approach we're learning, which is the letter L. It stands for low arousal. This refers to the importance of creating a calm and low stress environment for individuals living with autism. This helps them to concentrate and reduce anxiety. And before this can be done, the environment must be calm and well ordered, whereby there is no distraction. Yes, many children that we notice they have short attention span and the likes, and you want them to do some things. You need to be able to make that environment conducive for them to avoid distractions, so you can help them achieve what you want them to do at a time. Pause. Read. Right. Also, for individuals with auditory processing difficulty, they may require additional time to process information. This child has maybe hearing impairments or difficulty in processing what people say. You need to take your time, give them that calm environment so they can actually process what's being said to them before they can give you a response. Another example is for a child that has sensory processing disorder, whereby they tend to have sensory overload. Some of them are sensory avoidance, some of them are sensory seeking. You need to provide the necessary things that would help them to be able to carry out activities or tasks in a calm way without causing a sudden change, whereby they start giving tantrums, they get distracted and not being able to carry out the tasks assigned to them. For instance, you know that this child has sensory overload. You need to first of all set up maybe a calm environment just to help that child calm down before the child can carry out the activity. Till the child is giving tantrums, you never understood the triggers, you never try to calm the child down, you just bump, I want you to do this. The child will not be able to achieve all of these things. So you need to create an environment whereby it is calm, and doesn't need to have distraction. For some children, we need to take note of the space where we are, the color scheme, the noise in the environment that can cause distraction while engaging in attacks. So this way, when we actually do this, it helps to reduce anxiety, it helps to reduce distraction, and even help them to be productive in all they do. Now let's go to the last letter, which is letter L in the SPED approach, which is called linking. Alright, linking is actually a way of creating a connection, creating a link, an established connection between everyone involved in the intervention program of that particular child living with special need. The therapists, the teachers, the parents, the carers, and everyone in the profession, everyone in the environment, everyone in the community at large, to ensure and make sure this child is able to function in the society at large and not feel unsafe. Okay? Whereby we establish that we all have to work hand in hand to make sure this child can function well in any environment he finds himself or herself. And there is a therapeutic bonding between parents especially and their child that has a need. It is very, very therapeutic. The bond is so therapeutic that it will help them, to be able to function well in the society. Rather than parents that neglect their child, just scold them every time, they don't have this parent to child bonding, you can't get any results from this child. Once there is a connection, once there is a linking between you and your child, I bet you see a very good result in that child. The child will keep up and keep on achieving more and more success. In our community at large, we all need to link up together. We need to work as a team to make sure every child living with disability can function well in the society. Thank you. Now, looking at all we've explained, the major focus of this SPEL approach is to help children living with disabilities to be able to function in the environment without fear, to be able to do things comfortably, to be able to carry out activities in a way that they feel that yes, they are needed in the society, they are needed in the community. This SPEL approach will help them to be independent in all they do, and you won't have the fear of they would actually sideline my child, they will do this to my child. Once you actually apply this approach day in, day out in your child's lifestyle, in your child's routine, you would see that your child will definitely improve. You will see improvements in this child. And I want us to, learn more about this, have deeper understanding on it, and how to apply it in all that we do to help. The major benefit of this spell approach is independence. Independence in society, independence in any environment we find ourselves. Being comfortable, being courageous, to be able to do one or two things themselves without feeling less worth of themselves in society. And as parents, as carers, as therapists, as teachers, as caregivers, I want us to know that this spell approach is very, very important if we truly want our child to be able to function well in the society. I would urge us, to try our possible best to apply these approaches when we are with our words, when we're with our children, to help them do better in their daily life activities. All right, thank you very much for listening. I remain Oyedekunle Precious Ayomide. Thank you.